I'm at Children's Dental Service, and I'm gonna be getting a tooth pulled.
This is our second cleaning this year.
I just got 2 fillings.
They really like to come. They like to be able to get the stickers, but they also like to show off how nice and clean their teeth are.
I'm Sarah Wofja. I'm the Executive Director of Children's Dental Services. Children's Dental Services is a nonprofit organization that turns 100 years in 2019. Today, we serve close to 40,000 kids and pregnant women all across the state of Minnesota. We've really had this history of innovative ways to expand access to vulnerable and underserved populations.
We try to provide dental care to all low-income patients.
In the urban areas, we see underserved populations come from working poor, immigrant patients, new populations to our communities.
Many of them don't have insurance, and if they do have insurance, it's usually medical assistance, and medical assistance doesn't pay for the cost of care, so it's difficult to find a provider.
In our rural areas in Minnesota, we have many dental shortage areas.
People just living in rural areas really struggle to find a dental provider.
And among those dental shortage areas, we can have entire counties that don't even have a single dentist.
Without adequate dental coverage and without dentists in their communities who will serve them, people in rural communities really have no options for care.
When we do teledentistry, we send a dental hygienist into the field first, and they gather the information by taking x-rays and doing an oral assessment.
And they gather all the information necessary for a dentist to do an exam off-site.
So we're able to gather all that information at a computer in our headquarters, go through and create a preliminary treatment plan.
Before we come there, we have an idea of what we're going to see, and we can plan to see the people that need the most urgent care.
Then we send our dental therapists to the rural area and then do treatment on them.
And we literally have suitcase-sized mobile equipment.
This equipment is very compact. It can break down into the size of a suitcase on wheels.
So teledentistry has really broke down, again, more and more barriers that we have. Instead of deploying a dental team to go out there and just do exams all day, they're actually being deployed out there to get some of that restorative needs done right at that same day.
So we can do fillings, crowns, certain extractions, and exams.
Before we provided this initiative, there were patients who had to travel up to 4 hours in order to get to a dentist.
And they're so thankful that we're able to come out to these areas and provide the care.
Without this service being available to us, our kids probably wouldn't have even had dental appointments so young. This is something that makes it possible for our kids to grow up with a lifetime of good dental hygiene, good dental services.
It's really important because a lot of times it's hard to find great dental services. You want good dental services for children especially.
Para mí es muy importante porque realmente así se puede evitar de muchas enfermedades o caries de los dientes. Y pues como padre que soy, pues mi deber es de cuidarlos a ellos, y este es un programa donde nos ha ayudado mucho a mis hijos.
Children's Dental Services and I personally were so excited when we received funding from the Dental Trade Alliance Foundation. It's very expensive and difficult to fund a new initiative, so DTA funding has been critical. This project targeted 500 children and pregnant women in rural Minnesota, but so far we've been able to see more than twice that number.
I think that we're going to continue to see a lot of expansion. I think we're going to continue to see more and more kids get access to dental care.
When we can prevent dental disease, we save 5 times that amount in cost of follow-up care. So I really see this program as being a wave of the future, and DTA funding has enabled us to jumpstart this kind of sustainable, game-changing initiative in our state.
Thank you, DTA.